Good day, ladies and gentlemen, and welcome to today's webinar, The One Action Necessary to Avoid the 4% Medicare Payment Cut. All lines have been placed in a listen-only mode. You may submit a question during the webinar by typing it into the Q&A box on the lower left-hand side of your screen. We will be taking live questions at the end of today's presentation. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to Patrick and Uli. You may begin.
Good afternoon, everyone. I'd like to thank you for joining us for our first webinar this week to do our best to attempt to provide you with the information on how you can avoid the 4% Medicare payment cut for the first year of MIPS. Just going to briefly review for you here a couple of things regarding the MIPS program. You see there a schematic where it outlines the 4 different components of MIPS and the relative weight that each one of them has for this first year in 2017. This has understandably caused a great deal of confusion and a lot of consternation of folks about what they really needed to do. And that's why we're here today, is to try to help you navigate this in such a manner that you will not be subject to a 4% penalty in 2019 for failing to submit any data in 2017. In order to do that, we're going to focus on one specific component of those 4 components of MIPS, and that is the improvement activity. If you report one improvement activity, simply attest to having completed this activity for 90 days at some point in time during calendar year 2017, you will not be subject to a 4% cut in your Medicare payment in 2019. Now, there's a couple of different ways to do this reporting. One is through a qualified clinical data registry. The SSR, the Surgeon-Specific Registry, is a QCDR. And the second half of our presentation today, Uli from the SSR office in Chicago is going to instruct you on how you can accomplish this attestation via the SSR. The other option that you may have heard about is it is CMS's intent to have a portal on their website whereby you can attest to having completed an improvement activity for 90 days during 2017. However, as of this time, that portal at CMS is not operative. And our staff in D.C. are told that it will not be operative until sometime between 2nd of January 2018 and 31 March 2018. So our recommendation to you is that you use the SSR to attest to having completed one improvement activity for 90 days during 2017. An example of an improvement activity, which we think many surgeons are already doing these improvement activities. And these next 2 slides is an example of 8 of those. From the message that was posted on the communities, there is a link where you can look at a partial list of the improvement activities larger than the sample I'm going to show you here. This list that's on the link, that the link directs you to, rather, is a truncated list that was selected specifically for surgeons. Part of that list is in these next 2 slides. For example, if you consult a PDMP prior to issuing a Schedule II opioid prescription, that is an improvement activity. If you see new and follow-up Medicaid patients in a timely manner, that is an improvement activity. Similarly, participation in a QCDR, clinical data registry, or other registry run by a medical or surgical society specifically qualifying for this would be the SSR, then that is an improvement activity. If you participate in Maintenance of Certification Part 4, that is an improvement activity. Another 4, if you give your specialist feedback reports to close the referral loop, that qualifies. If you use structured referral notes, that qualifies. If you are registered with the PDMP, the Prescription Drug Monitoring Program in your state, that qualifies. And finally, An example is if you're using the surgical risk calculator, that qualifies. So now I want to run through just a series of steps because there's this question about, does MIPS apply to me? And this was the algorithm that we've laid out in some of our communications in various forms. The first step in that algorithm is you need to know whether or not your MIPS data is being reported by your institution, your employer, or your group. This is called the group reporting option. If your MIPS data is being reported for you, you don't need to do anything else. The second step is determining whether or not CMS has exempted you from participating in MIPS. And this exemption is going to be based upon what they call the low volume threshold. And this low volume threshold announcement, they started sending notifications out to providers in April. You should have received one if you are exempt. However, there is a simple way for you to determine if you are exempt by going to the CMS website there, that link, plugging in your NPI number, and then it will tell you whether or not you are exempt from MIPS or not. If you determine that your data is not reported for you, and if you determine that you are not exempt, then at this point we are recommending that folks do what they can, the minimal action required, to avoid the 4% penalty in 2019 for their performance in 2017. And again, what that consists of is you simply attest to having completed one of the improvement activities for at least 90 days during 2017. Uli is going to talk to us in just a minute about how to use the SSR to attest to this. And again, the CMS interface for this purpose is not yet active. So with that, I'm going to turn it over to Uli for her to run through the how to use the SSR to attest and avoid the 4% penalty.
Thank you very much, Patrick. And again, welcome everyone who is joining us today on this call, how to avoid the 4% penalty for 2019. And again, the link, make sure you check on the CMS website if you're eligible. And also just to kind of like show you a little bit what the options are in general, because that's also in light of 2018 for MIPS, you want to make sure also that you familiarize yourself with the program overall. And of course, what we're talking about mainly today about is option 1, how do you avoid the penalty, but just know that the option is also out there where people can submit more if they want to. Some people have decided to submit for a full year, and there's a lot of information that we also have on our certain-specific registry website. If you go to www.facs.org, quality programs, certain-specific registry, and then MIPS, you will find a lot of information. And so if you just want to submit minimum amount of data for 2017 to then avoid the penalty in 2019, you can do so as Patrick laid out with one improvement activity. There's also an option to just use one quality measure for one patient. And also some people may have their EHR reporting on advancing care information as was already laid out. So what is important to do in the SSR? And I'm skipping over some of these examples because we've already touched on these. But here are the 3 steps that you need to complete in the SSR. You want to make sure you sign up and consent to the MIPS 2017 participation, and I will show you in a moment how to do that. You want to attest to one improvement activity, enter your MIPS data as is appropriate here, and then the 3rd step is you will review and approve your MIPS data 2017 submission, which will become available early January. That's when you approve your submission. However, the steps as laid out you can do right now. You will have maybe already access to the ACS data platform, the SSR. If you don't, we can provide you with a link to register for the SSR. And for ACS members, for fellows, it's actually free. And here is how you log in. You see your cases on the main screen. You have a menu on the left. Here's form management. So that's where you actually click. Form management, this is where you find the consent under clinician form. You click on that, and then you use Add New, and that's where you find the MIPS participation agreement. You will find the details of it. You want to make sure you read through it. Then you want to make sure you consent to it. Click on the checkbox, and then you scroll down further. You will fill out your individual national provider ID. You can also look it up here, but if you know it, you can just type it in. You also have to put in your TIN, which is your taxpayer ID number. And just so you know, we handle this information securely. And some people I know have more than one TIN. Probably if you only have one improvement activity, I imagine you would only use one TIN number. Once that's filled out, you scroll down further, and you see actually right down here the CPIA, which is the improvement activities that you can fill out. But before that, you also see some questions. You want to look through them, select whatever is applicable, and then down here you have the dates. So select the improvement activities and the attestation time period, which in this event you pick one. You have a lot of different improvement activities you can choose from. However, as was pointed out earlier, there are some that are probably pretty safe to choose because it's already something that you are doing currently. However, one of the things that I will point out, there are some suggested documentation based on the improvement activities chosen that CMS suggests to make sure to have in place in case there ever will be an audit. And then here you pick your partial year, which would be the partial year period for the 90-day period. And then you see below, you will see how you enter the start and end time. So you want to make sure that it's exactly a 90-day period. So if you pick January 1st through March 31st, you may be short of 2 days, so just make sure. It will give you a message. And it will always give you a little message here that this is for the period, but you can ignore that for now. So always when you attest to 90 days or less, there is a little message that will show. Now at the end, you want to be really sure you click the Save button on the top, Save and Exit or Save. And if you only choose to report on one improvement activity, that's pretty much the data that you will enter. Now come January, we will notify you when the previous submission report or the approval option is available. It's something that is being developed right now. And then you just go back to this place and you would save your submission, you would approve your submission, and then it will give you a message that it's completed. And if you have any questions, of course, we are here also to assist you. We are happy to walk you through the process, or if you have other questions, if you want to do something else besides the improvement activity, you want to do something with quality measures, we are happy to help you through this process. The SSR team is available for this kind of programmatic support. And here's my team is listed here, Michael Bencor as well as Regina Clay. And then we also have advocacy who is available for certain questions, or ACS technical support. And also, like, for certain questions, you can also, of course, contact CMS as is appropriate and as is needed. And that is really the end of my presentation of how to accomplish these steps through the SSR. And I think we are opening this now up for questions.
I'll just jump in and say that for those of you on for us, we are recording this, and so the recording of this will be available. I'm going to post a link for the recording sometime in the next 48 hours after I get the recording itself from our technical folks assisting us with the webinar today. And also, if you wish to watch this again live, we'll be doing another one on Thursday the 7th. On Thursday, it will be at 3 p.m. Central Time, 4 p.m. Eastern. So with that, Jen, I'll turn it back to you.
And also just one quick add-on. The TIN, of course, should be the tax identification number that is associated with the billing of your Medicare patients. Thank you.
Thank you. The floor is now open for questions. You may submit a question through the web by typing it into the Q&A box on the lower left-hand side of your screen, or you may ask your question over the phone by pressing *1 on your telephone keypad. Again, ladies and gentlemen, if you do have a question, please submit it via web or press *1 at this time. Again, ladies and gentlemen, if you do have a question, please submit it via web or press *1 at this time. And there appears to be no phone questions at this time. I'll turn the floor back over to Pat and Uli.
Great. Thank you, Jen. I really appreciate everybody participating and listening in today. We hope that we have explained to you how you can use the SSR to avoid the 4% penalty. As Uli has laid out, we are available both in the SSR office and in the DC office to answer your questions and to help you. As I have said, as I've gone across the country and presented at state chapter meetings, that there is no reason that any surgeon should take a 4% penalty this year. They should absolutely take the steps necessary to avoid that 4% penalty. And doing this improvement activity attestation through the SSR, we believe, is the simplest way for you to accomplish that with minimal effort.
Thank you so much. And I just want to respond also to one question that I'm seeing in the Q&A. The question is, where are the suggested documents for improvement activities? So first of all the improvement activities are also listed on our website with some more detail. And we can send it to you after this meeting. There's a document that we will also make available on the web in the coming days that has the suggested documentation based on CMS requirements that should be in place for choosing certain improvement activities and the recommendations that they have put forth. Thank you so much. And there was also, I think, one question about whether military surgeons who are currently in the military should report. Again, I would check the CMS website whether you're eligible. If you do not see any Medicare patients right now, most likely you will not be eligible, and would then report on MIPS once you're eligible for the program.
Yeah, Dr. Lynn, if you're still on the line, if you want to give me a call at that number that I responded back to you after we are off the phone, I can ask you a couple of questions that I think might clarify what best choice for you might be at this time.
And then there's one more question. Will these slides be available for review? Yes, I think we will post the webinar, right?
Yeah, the webinar is being recorded, and as I said, will be posted shortly. I'm going to put a link to it on the general surgery community after I receive the link from our folks who are helping us put this on.
Excellent. We can give it a few more seconds if anybody else has a question.
All right, Jen, I think that we've got the questions have been answered that folks have. And again, if they have anything else they think of afterwards, they have multiple options. They can either reach out to us in the SSR office in Chicago, in the Division of Advocacy and Health Policy here in Washington, we'll have that other webinar on Thursday, or they can follow the link and or view this one again when it's posted.
Great. And I just see two more things. One is like, what if I'm only assisting a surgeon? If you're a delegate, for instance, and you have delegate access to the SSR, you can also actually do this kind of documentation for the surgeon or on behalf of the surgeon. Please contact us at our ssr@facs.org email. We can assist you further with specific questions. And then there's one more, so I don't need to submit 20 patients to Medicare. If you just want to avoid the penalty of 4%, the answer is this year, you don't have to submit 20 patients. You can just submit one improvement activity or one quality measure because this is a transition year. However, the requirements will be more stringent for 2018. So that's something also that I just would like to put out there in terms of like, it's a good idea to familiarize yourself with the program so you know also what to prepare for next year. I hope I answered your question, Dr. Pittman.
Okay, great. Thank you. This now concludes today's webinar. We thank you for your participation. You may disconnect your lines at this time and have a great day.